stars in the night.
Welcome back to Good Morning San Diego. Today we are fighting wrinkles. There's a new breakthrough for anti-aging. Dr. Edward Victor Ross in studio this morning joining us to talk about it, as well as Dr. Vineet Mishra and a patient, Mary Ellen Campo. Good morning to you all. Thanks for being here.
Good morning.
Doctor, we'll start with you. Tell us about this procedure. What's it called and what does it do?
Well, the device is called E-Prime, but the procedure is called Evolastin. And the goal is to actually promote elastic tissue. When you look down, like you're reading a book, when you get older, the skin kind of sags. We're trying to get that skin to kind of perk up a little bit and stiffen a bit and regain its elasticity.
Okay, we have some before and after pictures, and kind of walk us through what we're seeing as far as the differences.
Well, this is a typical patient. As you get older, your skin loses that elasticity that it has, and so it tends to fold like this. I call this Venetian blinds, or sort of corduroy-like skin, and you don't want your skin to look like your pants. So what happens, this skin sort of folds up, and what the goal of this procedure is to undo that, to restore that spring that you had like a slinky, get that spring back into your skin.
And this looks like it's targeting those jowls.
Yes, it will do something for the jowls. So it's sort of a minimally invasive, almost facelift. There was a study done that showed it gives you about 30% of a facelift, but it's non-invasive in the sense there's no sutures or no wounds like that.
And then for another picture, that definitely you could see the difference. I mean, it looks like 10, maybe 15 years are taken off.
Exactly. Again, it's the restoration of the elastic tissue that really promotes that. Everybody talks about collagen. Collagen's important, but elastic tissue may be even more important.
Okay, so you said that this is a relatively simple procedure. You brought along Mary Ellen,
yes,
who I assume is under anesthesia right now.
Well, it's interesting. So her left side has been numbed with a local anesthetic, that's all. And that's why she's a little swollen over here. And we've already done about 10 or 12 pulses. So what we'll do is maybe do a few more pulses and show you sort of how the machine works.
Okay, go ahead, doctor, and just kind of walk us through what we're seeing here.
Right. So I'm going to grab the device. This is the handpiece right here. What I'm going to do, I'm going to deploy the needles. So if you look here, hit the treat button here. And the needles are deployed. There are 10 needles here. There are 5 pair of needles. And what happens, these needles are deployed into the skin simultaneously, and electric current goes between the needle sets. So we'll do that right now. We're going to retract the needles, and then we're going to come over here and place the handpiece up against the skin. I'm going to put my little goggles on here.
Okay.
And we're going to go right here. 1, 2, 3. And then we deploy. So it's heating for 4 seconds at about 68 degrees Celsius. And we advance another 3 or 4 millimeters and do the same thing. We're simultaneously cooling the surface of the skin and delivering heat inside out. So the key thing is inside out. These are little needle sticks, so there's no real damage to the skin surface. We'll just do one more here.
How long does a typical procedure take?
Including the numbing, about an hour and a half. The procedure itself takes about 45 minutes to deploy about 150 or so pulses. And that's a typical time of a procedure, the typical number of pulses.
And when will you start seeing results?
You'll start seeing results typically in about 3 to 4 months. So it's not immediate. You have to wait because the elastic tissue takes some time to form after the procedure. It sets into motion a cascade of events where elastic tissue will form as a result of the procedure.
We know you're numbed up, so just tell us, did that hurt or couldn't feel a thing? Okay. How much does this cost?
Well, the procedure roughly costs between $1,200 and $2,000.
Okay, and once you do it one time, are you good for the next 10, 15 years?
Well, you're good for several, at least a year or two. You might get a second treatment because inevitably time marches on and you have to kind of get a little bit booster shot every now and then. So you might need some booster needles down the line. But it's that really controlled combination of time and temperature that allows this procedure to work. It's like cooking something. You have to cook at a certain time and a certain temperature for it to work just perfectly.
And what is the reason that most patients are coming to you for this? It's just simply to turn back the clock?
Yeah, it's usually women who are, and some men, but mainly women age 40 to 55. They start seeing that first sag, and they don't even know how to really convey it. It just feels like their skin doesn't have that perkiness it had before, and that's what we're trying to do, is kind of get that skin just up a little bit. It's a subtle type of reaction, but it's one that people can feel it better than they can see it sometimes.
Okay, where can we find out more information about the procedure?
You can go to our website at Scripps Clinic, and we have all the information there.
Okay, so if I keep doing this, my grandma always told me, go like this. It'll help.
Your hand muscles will get stronger.
I don't know. That doesn't do anything for the skin?
I don't know if it do that much for your chin.
Okay. Well, thank you guys so much for stopping by. We appreciate your time.
Thanks a lot.